Hi, welcome back to Two Dope Black Doulas. My name is Brittany Jones,
And I'm Danielle Watson Murray.
and we're your Two Dope Black Doulas. Yeah, give us a round of applause. On today's episode, we are honoring Black Maternal Health Week, and we just want to highlight the importance of collaboration and community within our Black maternal health spaces and creating a space for Black women. I want to start off by giving you guys a quote or giving you guys the statistics that Black women are 3 to 4 times more likely to die from pregnancy related causes than white women. And with over 60% of the deaths occurring in the postpartum period. So let that sink in. 3 to 4 times more likely to die than white women, with over 60 of those deaths occurring in the postpartum period.
And
And so we just want to highlight that and just talk through why it's important to celebrate Black Maternal Health Week and to strengthen our leverage and strengthen our what we have to support Black women in the maternal health space.
absolutely, I think, that number is alarming. Again, one of the reasons why myself, Brittany, and so many other Black doulas get into this space of being a doula is that number is terrifying to say the least. And I think there was a recent report within the last maybe month and a half or so that came out where they claim overall nationally the birth rate is increasing in terms of mortality, but for Black women it's actually worse. So
Hmm.
everyone is trending up but Black women. So it's really important that we do have Black Maternal Health Week and we honor it. There's so many organizations that are able to bring it to light over the last few years, and it is a pivotal moment in this state of America more
Hmm.
than
Absolutely.
more than ever before, because so many of our rights are being stripped away. We have a lot of science, to me, not really taking the forefront. So we don't know how the data might be skewed. There's a lot of unknowns. So at this point, we want to make sure that we are informing our audience, informing each other, and building that community and that collaboration as much as possible.
Absolutely. And so when you think about the Black maternal statistics as far as the data goes, and there are various different factors that science, or science as we consider it science,
Yeah.
has has signaled to us of like why this is this way, why the
Mhm.
statistic is this way. Racism being the forefront, not blatant in your face racism, but racism in the systems and structures that are created in the health space, that not only for, and I know I've said this in previous episodes, but not only for Black maternal health, but also for Black health in general. When you look at how we look at, lung capacity, for example, for people who need, certain transplants and things like that,
Exactly.
there's different standards that, some medical systems use compared for Black people compared to white people or compared to Asian people and white people. So, racism, not necessarily blatant racism in your face, like I'm planning to hurt a Black person today type of racism, but racism in the sense of how our structures are set up.
Yeah, systematic racism is very real.
Another factor, if you think about it, is the access to care for a lot of Black people in America. A lot of Black people especially live in rural areas or areas that are considered health deserts. They don't necessarily have that direct access to care, or there may be other barriers to care, such as them not having insurance or being able to afford care. So those pieces play a part in what we're seeing with the Black maternal rates. Also, another piece to add is weathering. There was a term that was coined
Mhm.
called weathering, and the weathering of the Black body, and how that has contributed to some of, not even just in the maternal space, but in general in the health space, of how we've gone through so much as a people from pre-slavery, slavery to where we are now, just not having access to care and all of the different things, and how that's taken a toll on us, how it's taken a toll on our mental health that also affects our physical health as well. So it's this number that we're seeing and these statistics that we're seeing isn't a one-fold, oh, we need to correct this and it'll
Right.
directly affect and we'll see improvement in these numbers. There's so many different nuanced pieces that need to be corrected in a sense to be able to see improvement in those numbers. And it's a long time coming. I mean,
Yeah.
we knew from Margaret Heckler's report in 1985 about the disparities in health for people,
Right.
for Black people, and we're in 2025, and we're still in some areas still in those same disparities.
Because no one, it feels as though no one cares or no one is listening, environmentally, even generational trauma. We talked a lot about that through our lead program on how from, as we always, my favorite is talking about slavery, but literally the foundation of how so many Black Americans became Black Americans through slavery and through that trauma and through that horrible, horrible godfather of gynecology,
Right.
when they are performing pretty much using these Black women and enslaved women as guinea pigs and performing procedures without any medication on them for years. And I feel like what fast forward another 100 years or so, whether it's like the Tuskegee Airmen, you do all these experiments really that come with getting to know science as we know it, but
Hmm.
then it's a distrust that starts, and that's where that trauma comes through, where people are like, well, I don't feel like I want to go to the hospital or get
Hmm.
a doula or have even a midwife because I don't trust
Or
the
speak
system
up,
or
speak
speak
up in
up.
the room
Ooh,
when
that
I'm,
was rough.
working with my provider and my provider's telling me I have to schedule an induction because X, Y, and Z. And I feel like I have to play the role of the good patient. So I'm not labeled the angry Black woman or the patient that doesn't listen, with that dynamic too.
Stereotype. And I think, you mentioned it earlier, Brittany, about postpartum. That's a big part, a huge part of Black Maternal Health Week is the postpartum period. It's not just, oh, thank God I made it through bringing my baby earthside. It's that after effect.
And taking
And
care of yourself, right?
exactly. And you got to visit your pediatrician with your new baby, and you go to your appointment with your OB, and they ask those questions on that test of like, how are you feeling? And you're like, I feel great. Meanwhile, you're feeling like you're literally dying inside because you're
Right,
sleep deprived, and you may not be getting the nutrition you need or the help at home. It could be anything that could be
right,
attributing to this, and it's a major part, I think, of postpartum and just even bringing a baby birth side that we don't talk about enough. But that's part of, Black Maternal Health Week, to bring that to the forefront, to say it's not just thankfully having baby here. It's like, how is mom doing? How is birthing person doing? How are you really doing? We don't want to take your baby away. We want you to be well first.
right, right. And I'm glad that you said that because I was going to say, I think for a lot of people, the reason why we feel like we have to mask how we're doing, and the reason why we feel like we can't tell people how we're really truly doing, or only certain people can know how we're really
Okay.
truly doing, is just
Yeah.
connected back to those, like, first of all, the experimentation we don't trust. And then second of all, we don't trust that if I really tell you how I'm feeling, you're not going to be like, oh, you don't need to have your baby. Like, you feeling like that? Oh, let me go get that baby and make sure that baby's
Right.
safe. Rather
Saving the
than like
situation.
providing help and the support to keep you and your baby together and give you the support that you need. So for so many women, we suffer in silence with intrusive thoughts, with racing thoughts, with the anxiety and depression. And I feel like in social media, there's been recently
Hmm.
a very good push in like calling that out and letting
Yeah.
people express how they feel. Like I might have went into this motherhood thing thinking it was going to be one thing, and then I get into it and I might be like, hold up, this ain't what this ain't what I was expecting. I don't know if I really want to be a mother. I might want to tiptoe back. Can I tiptoe back out of the room? But
Maybe
just
some
calling
social
that
media
out. Yeah.
is not the real deal. The sleepless nights are endless. The hormones are raging against your will a lot of times. It is a moment in your life where you're trying to literally redefine yourself and redefine baby because they are here. This is new to them as well. So
Mhm.
they're looking at you like, hey, I've been inside it and I've been nice and warm and cozy. You fix this. And you both are looking at each other crying like, you help me help you. Help me help you. But it's like you mentioned, Brittany, like it's so scary when you think about it. Again, the Black maternal health, as Black women, we already are up against a lot every day. And to take that on as a new mother is overwhelming at times.
Mhm.
So we always want to highlight that and make a sacred space and a safe space for that.
Absolutely. Absolutely. And knowing that both can exist, right? My kids
At
can
the
drive
same
me
time,
absolutely crazy, but I also
right.
still love them to death and will fight anybody that comes up against
On
my
look on site. Don't you get up in here. I said it.
so like both can be true at the same time, and just allowing that space. It doesn't have to be motherhood, and being in that postpartum period doesn't have to be all flowers and sunshine and dandelions. Sometimes there are times where it's tough, and like you said, it might be a lot of sleepless nights where you're trying to, especially if your baby has something like colic or
Yes.
something like that, trying to experiment and figure out what it is that works for baby. What does baby like figuring that out and giving
Right.
yourself grace, because those people that you see on social media that be like, oh, motherhood is this and I just do this, like, yeah, that might be the case for them, but it may not be the case for them, and they're
Right.
just putting it on camera to make it seem a certain way, but in reality their lives may not be the way that they depict it.
Exactly. They may have literally four nannies. They may have family that helps take care of said baby. I think Brittany and I, as doulas, one thing I feel like we say a lot to our clients: stop Googling everything. like, we,
Absolutely.
because a lot of it is not true. Not because the science doesn't say so, but a lot of
Mhm.
times the facade of it all
Mhm.
is not
Mhm.
true. The snapback, the
Mhm.
perfect pregnancy. There's a lot of times you might have your head in the toilet. So part
Right,
of
and you might
the
have hemorrhoids after, like
hello, tell me about it.
and that doesn't mean that something's wrong with you or your
Exactly.
body. That's just
No.
the typical symptoms that come from pregnancy. But
It's
people don't
not.
talk about that piece. They don't talk about
No.
the ugly or the bad or the not so desirable piece.
Right. Right. It's definitely not bad because the journey to parenthood, the journey to motherhood is different for everyone. Surrogacy could be infertility, we talked about a lot, but I think the piece of having that Black Maternal Health Week is to just focus on us because a lot of times we do not have that authority to just say, hey, if my baby has this or if I'm seeing this on my skin, is that normal? Like the
Mhm.
linear line that we get as Black women
Mhm.
or dark skinned women when we're pregnant, Caucasian white women don't normally get that. We get it.
Mhm.
And a lot of times we're like, something wrong with me because you look in books that there's no book that says that unless the book is just for us.
And to that point, I just read something on a public health, like social media space,
Mhm.
where they were talking about the importance of concordance, and for those who don't know what the word concordance means, but
Yes.
making sure that your provider looks like you, or you have a team of people who look like you, have similar
Hello.
experience and background like you. They were talking about that importance in healthcare and why it's just so important. And the social media post went on to say, like, they were about to amputate this client's foot because they thought that the person had gangrene in their foot. they thought the foot was frostbitten to the point that they were going to amputate. And come to find out, the person just some skin condition but the skin looked like dull
So,
and dry, and but it was some kind of skin rash, like dermatitis type thing that was very well treated and did not require amputation. And they were like, this is very well why we need concordance, because the person that looked like that patient was able to step in and be like, no, they don't need their foot cut
right,
off.
like
Like,
this is what this looks like on our skin.
right, right.
They don't. It's scary, but because there are not enough representation in medical books and such, because and if your providers have never seen that, it's
Mhm.
it's a whole new world. It's a new journey for them to say, oh, I never thought of it like that. And literally, data has shown when you have people in the room that looks like you, your outcomes in healthcare are so much better. Like literally
Absolutely.
50 to 70% chance of survival. So I think that's important as well. So I'm
Absolutely.
glad we were able to kind of just get through that, because it is a matter of timing where we have to always look into the importance of our health.
Absolutely. So I think that is a perfect segue into just saying that within the Black Maternal Health Week, and as we celebrate Black Maternal Health Week, thinking about ways that we can come together as a community to support each other within this Black maternal space. What can that look like? Does that mean hiring a team of doulas, or a doula and a provider that come together, work together to help to support that client in that space, but utilizing the resources that we have to like support our people.
Exactly. It's all about collaboration, community. That is the word of the year for me.
Absolutely. Absolutely. Well, we thank you guys for joining Two Dope Black Doulas. We hope that you will tune in to future episodes. Thank you and have a great day.
Bye.